very much, Camilla. I have to say that Camilla's talk just resonated very strongly with me as somebody who did relocate and then have to, career building was my topic, but really it's actually career rebuilding when you move from one country to another. I'm not quite sure how I ended up here at Boston Children's Hospital and teaching in the Harvard Medical System when I started in this rural town in Australia. And I would like to say, like, Camilla seems to have been a lot more thoughtful and a lot more deliberate in how she went about doing what she did. I didn't plan to move to the US to continue work. I wish I could tell you that it was easy, but I think Camilla's given you some insights that it isn't particularly easy. And I wish I could say I'd do it again if I knew what I knew now. I probably wouldn't, but I actually wouldn't change what I do now either. So I'm not leaving, but it's a lot of work and there are a lot of obstacles that you have to overcome, and you do have to be humble. And sometimes you have to be humble about your skills that other people no longer see as valid skills because they weren't obtained in the jurisdiction that you now work. And so I think becoming recertified as an orthopedic surgeon in a new jurisdiction once you've moved from one country to another is very challenging. I'm going to call these my early years. They happen to be like the first 15 years after high school, where I was in Australia and I did all of my training in Australia. And it was during this time that I developed a weird subspecialty interest in pediatric upper extremity surgeon, which in Australia at the time, there really wasn't an orthopedic specialty or a fellowship that I could do that. And so therefore, I truly, as Camilla spoke about, that mentors are absolutely instrumental. The first two gentlemen are Professor Graham and Mr. Terode, who were from Melbourne, and they reached out to their friends and colleagues who were Dr. Kasser and Dr. Ozaki from Boston Children's Hospital and Texas Scottish Rite. So really, you can be lucky or you can have good friends. And I think that good friends are very important, in particular senior mentors, if you're looking at changing, if you are looking for international opportunities. I went about very deliberately developing the skills that I needed to have the specialty that I wanted to have, which was to do pediatric upper extremity limb reconstruction, which isn't really a defined specialty at all. And then I did end up being recommended to come to the US for fellowships because there really wasn't an equivalent specialty in Australia, but people like Peter Waters at Boston Children's Hospital and Mary Beth Ozaki at Texas Scottish Rite had established that as a specialty. So in order to do my pediatric orthopedic and pediatric upper extremity fellowships, I had to suddenly at PGY 10 sit my USMLE step 1, 2, and then get my ECFMG certificate. You really can't work in the US without your ECFMG certificate. And if you want to do fellowships, there are several ways to do a fellowship. And I think Camilla outlined one of the things is that outside of the US, you don't realize how many rules and how the biases within the match process work to enable you to actually be successful in the match. I actually did go through the San Francisco match and I was successful. I thought I had not been because I didn't get the call on the day that I was meant to. It turns out that the people who had selected me didn't know how to call me in Australia to tell me that they'd selected me. So I just had to wait for the email a few days later. International clinical fellowships are around. They're not as widely advertised. They'll still require you to become ECFMG certified, but they are often outside of the match and they do look for a more diverse group of trainees. International observerships, you need to know the vernacular. This means you're not going to touch a patient, but you can be seen in the clinic office, okay? And so if what you're wanting to do is get exposure and learning, but not necessarily hands-on, then an observership might be the way you go. And then international research fellowships, so that was Camilla's first one. They're actually non-clinical. You might get a little bit of fortuitous clinical exposure, but you're actually mainly doing research and publishing papers in that time. It may be a stepping stone for some people though. I personally was not very research focused. And so that was not for me. I had always planned on returning to Australia. Some administrative changes happened at our children's hospital whilst I was away. I was very determined to pursue my chosen clinical specialty. And so therefore, opportunities came up in the US that were not available to me, but I will echo what Camilla said, is that getting a job is much harder. And there's many things about getting a job which is hard. I now have a department that has resources that are, I don't even think I had the space in my brain to understand the resources that I have now in my clinical work. We have 3 upper extremity surgeons at Children's Hospital. Don Bay and Andy Bauer are my partners. Between the 3 of us, we have a physician assistant, we have a nurse practitioner, we have 2 nurses, we have 3 research associates, we have a research specialist, we have an academic assistant, we also have like a research manager, and we also have like an entire clinical effective research center in our department. And so therefore, the opportunities in academic medicine in the US were ultimately what led me to stay. I've actually done an MPH in the meantime, and even just doing an MPH as a foreign graduate was hard because I didn't have my medical school exam for the US, so I had to sit the GRE when I was also being an attending surgeon. So transitions, and Camilla said about this, it's not just about getting your piece of paper recognized. It's regulatory, it's professional, it's cultural, and it really is cultural. The longer I was in the US, the more I've realized how different I am to many of the people that I'm around. And I live in the Northeast, which is not, the US is not ubiquitous culturally either. And you have to remain legally in the country that you've relocated to. And that is actually maybe the hardest thing of all. I am still legal, don't worry about that. You think, when people think about the regulatory transition, they think I've got to get registered, I've got to get hospital credentialed, and I need to get insurance reimbursement sorted out at the end. No, none of it happens until you can get insurance reimbursement in the US. So it's actually the opposite way around, even although in your mind you think that once the Blue Cross Blue Shield, which is our biggest payer outside of our government insurer in Massachusetts, accepted me, then every other insurance company accepted me, and then I was fine. I did have to work for 3 years seeing patients with the government insurance without getting paid, but that was just another price that I paid to change jurisdictions. The professional transition is really hard. You lose all of that social capital that you have built up over the 10 years that I worked in Australia. I worked with Juliet when I was in Australia as a junior trainee. She was a younger consultant at that time, or attending surgeon. So I actually got congratulated as a PGY15 for graduating last year because it was the first year I had had a general medical license. So even to be recognized now as a doctor, despite the fact that I thought I was an orthopedic surgeon, I had to become recognized as a specialist again. And I was 7 years in, and the American Board of Orthopedic Surgery changed their rules that you had to be an associate professor. And at Harvard, people may or may not know, we have a whole extra level of academic rank. And so most associate professors are 10 to 15 years into practice, whereas at many other institutions, they may only be 5. And so I actually initially couldn't sit my ABOS and ended up, I am doing it now. The social transition was actually the surprising part to me because we sound and we kind of speak the same language, but Peter Waters was the head of upper extremity when I joined. And it actually took me 2 years, and after I had signed a contract, for me to realize when he said upper extremity surgeon and when I said upper extremity surgeon, the two of us were not actually meaning the same thing. And that's pretty fundamental because I was employed as an upper extremity surgeon at Boston Children's. You have to also reestablish credit. You know, you're a fully functioning adult, and now you get a $500 credit card that you pay a $500 deposit for. And that not everyone actually understands that your diversity is valuable. So finally, I'll come to immigration. You've got to be allowed to work. Eventually, you're probably going to want to stay and not be at the whim of the government to cancel your visa every 2 years. And then you need to have had a visa that allows you to citizenship. It's the hardest part, but it's the most complex, and it's very country specific, so I won't go into that further. So just as a little snapshot, I actually graduated medical school in 2001, so the same year that Camilla did, and I am still not board certified in the United States of America. I work under an academic medical license. I have 2 years ago done the written first part. I've done my case collection, and now I'll have my case defense this year. but I've been here for 10 years and I'm still not able to spend my whole time doing the fun, interesting research that I like doing because I'm spending a lot of time surviving. And so you just have to know that that's what you're going to do. However, I do get to do really cool things. I get to bring together all of my different fellowships. And so I wouldn't change anything. This is the most important slide. Many people will offer you advice. All advice is well-intentioned. Not all advice is accurate. You do not need 3 fellowships to work in the United States. I only had 1.5 years. Those who have gone through the process are best situated to give you advice and to help you solve the crinkles and interpret the English language. And I mean the English language between the US and Australia even. So if you come from a more divergent cultural background than that, it's even harder. So you want to reach out to people. Mentors are essential, but they're not necessarily experienced, and they can feel really helpless helping you negotiate this process. And it is a journey. And no, you're not going to always win. And yes, you are going to come up against barriers, but it can be exceptionally rewarding. I will tell you that on the far right here is Martha Murray, who is now our chief at Boston Children's Hospital. She was the first full clinical professor of orthopedics at Harvard Medical School, and she now leads our department. So although administrative changes at home meant that I didn't return, administrative changes here at Boston Children's Hospital, I think, are really looking to the future. Feel free to reach out to me if I can help anyone.